Hello, everyone, and welcome to the Legal Assistance of Western New York Navigator Services presentation. My name is Daniel Palermo, and I am a certified New York State of Health Marketplace Navigator. Joining me today is interpreter Jennifer Beratan for those who have hearing difficulties or impairments. Today, we will be discussing the full scope of Navigator services offered by Legal Assistance of Western New York, otherwise known as health insurance options in New York State. On today's program, we will discuss the insurance options that are available in New York, an overview of the programs you may be eligible for, the ways to apply, any specific program details within those, and any questions that typically come up during the process. There are a multitude of insurance options in New York State for those who qualify for coverage. And there are multiple ways to obtain that health insurance. Most people who live in New York have access to coverage through employment, through a workers' union, Medicare, the VA, which is the Veterans Association, or through a family member. Individuals and families who do not have these options available to them can apply through the New York State of Health Marketplace. In order to apply, they must be a resident of New York State between the ages of 0 and 64, with some exceptions. And individuals who are 65 or over, certified blind or disabled, or who require long-term care for Medicaid should apply through the local Department of Social Services or Human Services. Anyone living within New York State can apply through the New York State of Health Marketplace, ages 0 to 64. This includes immigrant non-citizens. This includes people residing under color of law, and this includes people who are homeless or in shelter housing. There are several options available through the New York State of Health Marketplace as far as the different types of plans that are offered. Here we call them programs. Medicaid, Child Health Plus, the Essential Plan, which is separated into 5 different brackets, and what is called commercial insurance. These are small business insurance and qualified health plans, which may or may not include premium tax credits based on your income. That's something we'll discuss in more detail in another slide. When can New Yorkers apply and receive health insurance? Anytime during the year, New Yorkers can apply for Medicaid, Child Health Plus, or the Essential Plan. During open enrollment or with special enrollment periods, qualified health plans can be applied for any time of the year as well. If you are not applying for Medicaid, Child Health Plus, the Essential Plan, or you do not qualify for a special enrollment period, there is something called open enrollment. Last year, open enrollment took place November 16th through May 31st. This year, open enrollment will be taking place November 1st, 2024 through January 2025 on the 15th. Now, if you have an existing account and an existing healthcare plan, you can start your renewal application process October 16th for the upcoming health insurance year. Anything else is considered outside of open enrollment. Special enrollment periods are available to those who have significant life change events. Changes in income, changes in housing status, changes in family status, births, deaths, marriages, or a loss of minimum essential coverage, So to recap, the programs that are paid for by state and federal governments are HMO plans and include Medicaid, the Essential Plan, and Child Health Plus, which can be applied for and found eligible for anytime during the year. Commercial insurance, which are the qualified health plans or the small business insurance, are typically offered by employers or purchased directly by consumers through the marketplace. Those plans may include the full variety of HMO, PO, EPO, or PPO plans. That being said, most plans available do not offer out-of-network coverage. And the plans that are available through the New York State of Health Marketplace are only HMO and EPO. What this means is that every plan within the New York State of Health Marketplace is in-network coverage only. Standalone plans can be added through coverage through the New York State of Health for dental services and coverage if the plan does not already include dental. You can look up which doctors take which health insurances through the New York State Provider Health Plan Lookup tool. Navigators are here to assist you through the entire process from account creation, eligibility determination, enrollment, and plan selection, up to renewal in the future years. The New York State Provider and Health Plan Lookup tool can be very large and difficult to manage. Even if you're experienced with going through tools of this type, it might be beneficial for you to have a navigator assist you in guiding you through this tool to look up providers for your particular insurance plan. You can also find available dental plans using a similar tool called the Dental Comparison Tool directly through the New York State of Health website. As an overview of the programs that are available to you through the New York State of Health, there are a variety of eligibility determinations. These are factors that will determine whether or not you are eligible or are ineligible for certain types of insurance through the marketplace. Factors include household size, household income, age, citizenship and immigration status, pregnancy status, and disability status. Now, these are important to remember because while one member of the household may have all household members included on their New York State of Health account, every application is technically processed individually, even when done at the same time. In other words, if I am applying for myself and my family, which includes 4 other members, the application will include all 5 people in the household, but each application for each of those 5 members will be processed separately and run through all of those determining factors. If someone in your family has a different citizenship or immigration status, their household size may be calculated differently from yours. Their household income may be calculated differently from yours. And these all affect the eligibility of each individual member of the family. This is a very large chart that we're not going to go into too much detail on regarding every single option. The important things to note here are that you have information regarding the federal poverty level, which is the amount of income that classifies a household as being within poverty or above it. And you have the different types of programs or insurance plans available through the marketplace separated here. It's important to note that for Medicaid eligibility, the family household income must be at 138% or below the federal poverty level. As mentioned previously, the essential plan is separated into 5 different groups. This is abbreviated here as EP for essential plan. For immigrants who do not qualify for Medicaid and are under 100% of the poverty level, they will qualify for Essential Plan 4. Other immigrants who are otherwise eligible for Medicaid if they were citizens, in other words, 100% to 138% of the poverty level, will be Essential Plan 3. Those who are citizens and make between 139% and 250% of the federal poverty level will be eligible for Essential Plan 1, 2, or what is called the 200 to 250 plan. The last type of insurance that's offered for individuals is called Qualified Health Plan, abbreviated here as QHP. You will notice that there's a second abbreviation that says APTC. This stands for Advanced Premium Tax Credit. You can think of this like a discount that applies to the monthly premium that you would pay for that insurance plan. If you make over 250% of the federal poverty limit as a household, but under 400%, you will qualify for an advanced premium tax credit that goes towards your insurance coverage. To explain this, we can put it in simple terms. If you qualify for a qualified health plan with a tax credit, and your tax credit amount is $500 per month, that means if an insurance plan would normally cost you $501 per month as a premium payment, your tax credit can take off $500 per month, and you would only pay $1 out of pocket per month for that plan. If you make more than 400% of the federal poverty limit, you are still eligible to obtain a qualified health plan through the New York State of Health Marketplace, but it will be what is called a full pay qualified health plan, and the premiums will have no discount applied to them. There are multiple ways to enroll for a health plan through the New York State of Health. You are more than welcome to go through the process on your own by visiting nystateofhealth.ny.gov. In order to do this, you will have to use your newyork.gov ID if you already have one, or you will have to create a new one. Your newyork.gov ID is something that a lot of people already have and may not realize. If you have ever registered your vehicle online, renewed your license online, or filed your taxes online, chances are good that you already have a newyork.gov ID, which will be the same to use through the New York State of Health. If you don't have an account through the New York State of Health, navigators can assist you with this process and either guide you through it or create the account for you. Step number 2, or option number 2, is to work with a navigator for your healthcare enrollment. You can call us directly. My direct line is 585-572-1714. The Law New York main office intake line is 585-325-2520, or you can call our navigator hotline, which is 855-250-7748. You're also able to email me directly at dpalermo@lawny.org, or email our team at navigator@lawny.org. If needed, you can find additional help through the New York State of Health website, starting with newyork.gov. The New York State of Health Marketplace has a full list of available navigators, assisters, and brokers who are able to go through the application process with you for direct assistance. The third and final option for enrolling through the marketplace is to call the New York State of Health hotline directly to speak to one of their customer service agents for the enrollment process. While this is similar to what a navigator can do for you, there are a few exceptions. New York State of Health agents will not create an account for you. New York State of Health agents will also not typically help you through the process of creating a NewYork.gov ID. And New York State of Health agents will typically only provide you with the resources to check provider information, but will not go through checking the tool for you. So just a few things to keep in mind as you proceed. If you need additional help with other insurance questions that may or may not be related to the marketplace, or if you're unsure what type of answers you need to your questions, you do have other resources available to you. You can contact the Legal Assistance of Western New York main desk at 585-325-2520 or email intake@lawny.org. You can call the LawNY Navigator hotline at the number mentioned previously, or for more detailed health insurance questions and issues specifically regarding lost cards or benefits that have not been utilized properly by a provider, or other issues that are not covered by navigators or LawNY, you can contact the Community Health Advocates at 888-614-5400 or email cha@cssny.org. If you are elderly or if you require additional assistance not covered by those mentioned previously, you can contact the Independent Consumer Advocacy Network, abbreviated ICANN, at 844-614-8800 or ican@cssny.org. Now, this slide here says what to bring to an appointment. This is what we suggest if you make an appointment with a navigator and you're going to be meeting with them in person or doing an enrollment over the phone. It's important to note that navigators can assist anyone anywhere in New York State with an enrollment over the phone. However, we can only assist you in person in the county that we are assigned to. As an example, I am assigned to Monroe County, New York, so I can meet clients in person in Monroe County, New York, Rochester, Greece, Webster, and so on. I cannot meet clients in Buffalo, but I can assist them over the phone, just like I would anywhere else in New York State. While we recommend that you have access to the documents listed on this slide, you do not technically need to bring anything to your navigator appointment for enrollment assistance, as you may not have to provide any additional documentation through the application process. We do recommend that you have accessibility to the Social Security numbers for everyone in the household applying for health coverage. That is something that is required to be put into the system. If you have filed taxes in the last year, we do recommend having access to those records in case additional income verification is needed for your eligibility, or any other documentation to support an estimate of your current year's income. This can include pay stubs or an offer letter from an employer, a disability benefit statement, or something else that shows your current income. If you are an immigrant non-citizen or a person residing under color of law, we do recommend that you know and or have access to a copy of your alien ID, including the expiration date or any other immigration documents that you may have. When it comes time to select a plan through the marketplace, it's generally a good idea to know which providers your doctors accept as far as health insurance is concerned. The last thing that you want to have become an issue for you is looking at your healthcare plans and expecting that your doctor will take Fidelis when they don't, or finding out that you would really prefer Excelis and your doctor does not take that plan. So it's a good idea to find out which providers your doctor accepts for insurance ahead of time. That being said, we did mention the provider lookup tool earlier, which we can use during the application process in order to determine if your doctor accepts that insurance. You do need a New York State address in order to receive notices from the New York State of Health. However, there is a paperless option for notices, which means you can receive notices via email. You can also sign up for what's called a general mail address through the United States Postal Service if you don't have a traditional mailing address to use for the purposes of your application. This is especially useful for those applicants who may be homeless or in other transitional housing. The New York State of Health has very specific timelines when it comes to enrollments versus processing of those coverage start dates. New York State of Health uses the 15th of the month as the deadline for coverage to start on the 1st of the following month. As an example, if you apply for your healthcare coverage by July 15th, that coverage will start August 1st. If you do not finish your application until July 16th, your coverage will not start until September 1st. There are a few exceptions. Medicaid and the Essential Plan do have the ability to be retroactive to the 1st of the month in which you apply upon request. There are some exceptions to this rule. Another exception to the 15th of the month rule is when a loss of minimum essential coverage allows for a backdate of your qualified health plans. This is on a case-by-case basis through the marketplace. Next, we're going to be going into some more of the details regarding the different types of health insurance programs or plan options available to you. We won't go too heavy into all of the details, as these slides will be available for future use and viewing, and you're always welcome to either look up more information on the New York State of Health website or call our Navigator hotline for directions and information from us directly. At a glance, Medicaid services are offered through pregnant women and infants, children ages 1 to 18, parents and caretaker relatives of dependent children, or adults 19 to 64 who are not pregnant and not eligible for Medicare at this time. Again, based on the income levels of 138% or below the federal poverty limit. This is a quick breakdown of the income levels that could apply to someone who is looking to get Medicaid as their insurance. So again, you'll notice, typically speaking, 138% is the benchmark, but there are different levels for children ages 1 to 18, adults age 19 and 20 who are still dependents under their parents, or pregnant women, infants who are not born yet, or individuals eligible for other family planning benefits. At a glance, the Essential Plan is a newer New York State of Health Marketplace option designed for low-income individuals who are employed and working. These are eligible for New York State residents who are lawfully present in the United States, ages 19 to 64, and not currently eligible for Medicaid or Child Health Plus, and also are not eligible for employer coverage through insurance. Now, every essential plan does offer a set of services which we call minimum essential coverage. The different brackets of the essential plan have different copays associated with the different services, but one common theme through all essential plans, regardless of which bracket, is that no essential plan will have a monthly premium. This means that the actual cost of the insurance plan itself per month is $0. The only things that might have to be paid out of pocket for are certain premiums and copays based on specific services. Qualified health plans are those health plans available to consumers who do not otherwise qualify for Medicaid, the Essential Plan, or Child Health Plus, and again, are lawfully present in the United States and New York State residents. These also offer minimum essential coverage as a baseline, but can and often do offer additional services based on the different levels of care available. These are called metal levels, and there are a variety available: bronze, silver, gold, and platinum. Generally speaking, lower metal level plans will have lower monthly premiums, but will have higher copays and deductibles. Higher metal level plans will have lower monthly premiums, higher monthly premiums, and will have lower copays and lower deductibles. So that will determine what you go for as far as the insurance that you're looking for if you qualify for one of these plans. You have, generally speaking, a large range of selection when it comes to these type of plans, as there are not only the 4 different metal levels, but there are multiple providers available depending on which part of New York you're in. The Child Health Plus plan, often abbreviated as CHP, is a special plan for children who are under age 19, who are not eligible for Medicaid, are not covered by other health insurance, and are not eligible for or enrolled in coverage directly through a state benefit program. Children who fall under these categories may be eligible regardless of their immigration status. Depending on the family household income, the premium for the Child Health Plus plan might be $0, $15, $30, $45, $60, or full premium, depending on the specifics of the application. You'll notice that it does have a maximum amount for the premium in each bracket of the child health plan. These are on a case-by-case basis, as they do fall within a range of the federal poverty limit for the household. As a reminder, navigators are here to help you with everything from A to Z through the New York State of Health Marketplace. We can help you with creating a NewYork.gov ID and a New York State of Health Marketplace account. We can assist you with an account that you already have. We can help you start a new application, check your eligibility, and enroll in a plan for you or for your entire family or for a small business. We can also help you renew for existing insurance coverage that you have through the New York State of Health Marketplace. Help is available through our direct phone lines or email addresses. Help is available through our main Law New York intake line, and help is available directly through the New York State of Health. Anything that you need that is within the New York State of Health system, we can assist you with. Everything that's discussed with a navigator is always entirely confidential, and all information is kept within the New York State of Health system. There is no cost for navigator services, and you will always receive a closing letter after services are complete as a summary of the services that have been provided to you. If you have any questions or you're unsure of anything that you have heard today related to healthcare or the marketplace, if you have an existing account, or if you need to start one, feel free to reach out to us. We have 3 members on our navigator team currently at Law New York. Myself, Daniel Palermo, Robert Punt, that's Pundt, and Joanna Deering. We're more than happy to assist you with all of your marketplace needs. And one last reminder, open enrollment for this year is coming up soon. November 1st is the start date for new applications, and that ends January 15th. For renewals, October 16th is the start of open enrollment renewal processes. Thank you very much, and thank you again to our interpreter, Jennifer Beratan, today. I hope everyone has a fantastic day, and I hope everyone gets their insurance squared away just fine.